Hello everyone, I am Dr. Ryan Macklin D'Souza. Welcome to the exam-based case discussion series. Today we'll be discussing immune thrombocytopenic purpura in the perspective of pediatric exams only for undergraduates or postgraduates. So kindly note that this is not a teaching video. This is an exam discussion series only where I'll be teaching you how to attempt for a 5 mark or 10 mark question based on immune thrombocytopenic purpura. So this is for exam purpose only. I again stress this is not a teaching video. I'm just be teaching you how to attempt this question for exam, how to write it, how to gain extra marks, and how to present in a proper way. This is valid for UG as well as PG exam, because even for UG this ITP can be asked as a 5 mark question in medicine or in pediatrics, and for PGs it is a 10 mark or 15 marks question. So let's move on. What are the things that you have to write? This should be the headings for any disease which is asked in the exams. So in addition to this, you will also have to write one extra section that is for extra marks. You will have to write some catchy points, okay, and I'll be telling you how to write exactly. So let's move on and let's get into the discussion of ITP. So how will you write the definition of ITP? You will have to write it as immune. ITP is immune mediated reduction in platelet count. Immune mediated reduction in platelet count, that is nothing but thrombocytopenia. So immune mediated thrombocytopenia is ITP, and then you will be writing that ITP can be classified based on duration into three categories, that is acute ITP, persistent ITP, and chronic ITP. So based on duration we have three types of ITP. In acute ITP is for a duration of less than 3 months. Symptoms have started for less than 3 months, and persistent ITP is between 3 to 12 months, and chronic ITP is for more than 12 months. Simple, right? First we'll write a definition. Immune mediated destruction of platelets or immune mediated reduction in number of platelets or immune mediated thrombocytopenia is called ITP, and based on duration we are classifying it as acute, persistent, chronic, less than 3 months, 3 to 12 months, more than 12 months. Fine. This will cover your 1/4 of the page or half of the page. Next, we'll be writing about etiology. So what are the causes of ITP? As with any disease, it will be primary or secondary. Primary is where there is reduction in platelet count less than 1 lakh, but you are not associated with, it is not associated with any disease or condition. Okay. And secondary ITP, remember there are 5 causes. 5 causes of secondary ITP which you have to remember for exam. One is infection, second is autoimmunity, third is primary immunodeficiency disorder, fourth is drugs, and fifth is miscellaneous, especially malignancy. So which are the 5 infections that you have to remember? Just remember that in ITP it is mainly caused by viral diseases. So you have HIV, hepatitis C, CMV, varicella, and one more bacteria you have to remember is Helicobacter pylori. So 5 causes: HIV, hepatitis C, cytomegalovirus, varicella, and Helicobacter pylori. Then autoimmune condition, remember 2 conditions. Only 2 conditions that you have to remember is SLE and EPLA. Only these 2 will be important for exams. In primary immunodeficiency disorder, you will be seeing CVID. Drugs, especially remember heparin, because heparin causes heparin-induced thrombocytopenia, and then miscellaneous, that is lymphoproliferative disorders or malignancy. So now close your eyes and remember, try to remember what are the causes: primary, and you have secondary causes. In primary, there is decreasing thrombocytes, but there is no definite cause of ITP. In secondary, you have infections, you have autoimmunity, you have primary immunodeficiency, you have drugs, and it is miscellaneous causes. Okay. So after etiology, you will be moving towards pathogenesis. See, this diagram is not recommended for your exams because of 2 things. One is it is complex. Second, it will take time. You will get hardly 10 to 15 minutes to write a 5 mark or 10 mark question. Okay. So I don't recommend this. I put this image from Robbins just because to understand the concept. Okay. Why this leads to ITP. Okay. See, this is the endothelium. Whenever there is endothelial injury, it will expose subendothelial collagen. One Willebrand factor which is circulating in the blood will be attracted to this subendothelial collagen. One Willebrand factor will attract the platelets. So these platelets will attach to this one Willebrand factor using a receptor. Remember, this receptor is GP1B9A. Okay. And then platelets will attach to each other using fibrinogen. Okay, this is fibrinogen. And this receptor which mediates is known as GP2B3A. Why I'm stressing on this, you will come to realize in the next slide. Okay, so this is called platelet adhesion, and this is called platelet aggregation. Moving on to the next slide, this is what you have to write for exam. Okay, you have to write heading pathogenesis, And then you have to write this sentence: antibodies against platelets leading to platelet destruction is the pathogenesis behind ITP. So now I showed you that GP2B3A and GP1B9A, these receptors are present on platelets. So draw a small platelet and draw two receptors on that. Now there will be auto antibodies in the body which will be produced against these platelet receptors. So you will have to draw this IgG. This IgG structure is what causes opsonization of the platelet, and then it will be phagocytized by the macrophage, leading to destruction of platelet and then leading to thrombocytopenia. Got my point? The reason behind drawing this diagram is because, see, when you're writing paragraph or you're doing any flow chart, so everyone does that. So whenever an examiner, say you will be writing exam for 3 hours, but your examiner will correct your paper in 3 minutes. So he'll get less than 10 seconds for each question. So you have to present your paper in such a way that it is slightly different from it should be very different from what others have written, and the content also should be very different, so that it stands out in front of other papers. So this is the basic psychology behind each answer paper that should be written. Okay, so that's why I stress upon more diagrams, more flow charts. So if you write pathogenesis in this way, okay, just this image, so the examiner, when he corrects this answer paper, maybe by physical correction of hard copy or via online, this image will stand out, and then he will be forced to give you more marks. Okay, so after pathogenesis, we'll go into the clinical features. So examiner expects only two things from you, two things for ITP clinical features. That is, one is it is a well looking child. This point should be there in your answer. Second is bleeding, 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 nothing else. There's only bleeding, isolated mucocutaneous bleeding with no other signs at all. In history, you won't find any other histories which you get in other hematological cases like fever, weight loss, bone pain, night sweats, no family history of bleeding disorders. And on examination, you won't be getting hepatosplenomegaly, no lymphadenopathy, no weight loss, no bony tenderness, nothing, just bleeding. Bleeding is the only complaint. And in this patient, you have to notice also that this bleeding doesn't occur even with low platelet count. Okay, even though platelet count will be 3,000, 4,000, still bleeding chances are very less in these patients. Next, coming on to diagnosis, examiner expects from you one thing, that is it is a diagnosis of exclusion. Diagnosis of exclusion means each diagnosis, alternate diagnosis, should be excluded. Other causes of thrombocytopenia should be excluded. Then only you will arrive at a diagnosis of ITP. And the anemia which is present, that is decrease in HB, is directly proportional to the bleeding. The more the bleeding, the more to drop in HB. Now, one very favorite question of examiners in Viva is, when do you do bone marrow biopsy in ITP? So this is a very tricky question. There are two schools of thought. One school of thought, a few hematologists think that every patient with ITP should undergo a bone marrow before starting steroids. Okay. And one more school of thought is that in ITP, bone marrow should not be done because bone marrow examination will be anyways normal. However, when do you have to do bone marrow? Bone marrow is done when there is presence of fever, joint pain, family history, bleeding, non-petechial rash, lymphadenopathy. What does this tell you? Whenever you're thinking the diagnosis of ITP is less likely, that time you should do a bone marrow. As simple as that. Okay. Next, coming on to treatment of ITP, it is very simple. Just divide into acute and chronic ITP. Acute ITP divide into three categories. What is the symptom of ITP? Bleeding. So sometimes patient may not present with bleeding, or there will be minimal bleeding. So that time you have to just do is observation. So what if there is moderate bleeding? See, ITP is immune mediated, so you have to suppress immunity. So we will give steroids. And if it doesn't subside with steroids, we'll give IVIG. What if there is severe life-threatening bleeding? We'll, along with steroids and IVIG, we'll give platelet transfusion. Being a UG student, this is enough for you to know, and this is what examiner expects you to write in exam. But if you're PG student, you have to write the dose of steroid. Dose of steroids is 2 to 4 mg per kg per day for 7 days. And maximum dose is 120 mg. And IVIG you will give at 1 gram per kg per day for 2 days. Okay. So acute ITP divide into no bleed or minimal bleed, moderate bleed, and severe bleed. In no bleed or minimal bleed, just observe. Moderate bleed, steroids plus IVIG, and in severe bleed, along with steroids and IVIG, you will give platelet transfusion. So coming on to chronic ITP, same as in acute ITP. In chronic ITP, no or minimal bleed and moderate or severe bleed. In no or minimal bleed, you will just do is observation. And in moderate to severe bleed, you will be trying for new things like rituximab. L-thrombopag, high dose steroid, and rarely splenectomy. However, in children, splenectomy is not recommended, but in refractory cases, you can go for that. For secondary ATP, see, now tell me the causes of secondary ATP. We had discussed earlier, primary ATP, secondary ATP. Secondary ATP, 5 causes. What are the 5 causes? One is infection, second is autoimmunity, third is primary immunodeficiency, fourth is drugs, and fifth is miscellaneous, that is malignancy. What are the infections that you saw? HIV, yes, very good. Hepatitis C, yes. Helicobacter pylori, CMV, and varicella. As simple as that. For secondary ATP, we'll treat the underlying cause. As simple as it gets. Just acute ITP, 3 divisions. What are the doses of steroids and IVIG? Chronic ITP, 2 divisions. And secondary ITP, treat the underlying cause. Then what is the prognosis? This also examiner expects from you if you are a PG student. So in 75% of the cases, what will happen is this acute ITP in 75% of the children, it will resolve on its own. It will resolve, and within 2 to 3 months it will resolve. Okay, and even if you don't diagnose it, then also it will resolve. So prognosis is good in ITP. However, 20% of the cases of acute ITP will progress to chronic ITP, and in less than 1% of the cases there will be IC bleed or intracranial hemorrhage. Okay, so now whatever I said from beginning, every student will be writing this. So what makes your answer different from the others is this. For extra marks, you will be writing new treatment modalities for ITP. 3 agents, rituximab, L-thromboplag, romiplostin, and these 2 are thrombopoietin receptor agonist. So you could have written this, the same thing, okay? You could have written under treatment, but I have purposefully not written under treatment because if you write in the treatment, it will be masked between these answers, it will be sandwiched somewhere and it will not come into the attention of the examiner. So to get the special attention of examiner, to divert his attention, you will be writing this at last, and you will be writing heading the new treatment modalities, and you will be writing this new drug, so that examiner doesn't miss this point, and he'll definitely give you extra marks because you are knowing more things than rest of the people. These are some of the basic things you should be knowing when you're writing for any exam. So no matter you read less, you can just watch my videos, you can just copy these things, memorize this, and you can mug it up in an exam, just vomit it out. These are the basic things which is needed. This is more than enough for a 10-mark question. Do you get it? Okay, so how will your question paper look at the end of all this discussion? You'll be writing a heading in the center, so that it will grab much of the attention. Okay, then you're writing about the terminology, that is different terminologies used: acute, persistent, and chronic. So I have used flowchart because flowchart will give more visual attraction to the paper. Okay, then I have divided ITP according to the etiology and have written all these etiologies here. Then pathogenesis I have written only one word, and then I have written this diagram because this diagram obviously grabs the attention of the examiner. See, examiner will be correcting 20 or 30 papers in a day, and only one paper has a diagram. Obviously, the subconscious mind and even consciously also, he will be willing to give you more marks because of the effort that you have taken. Okay, and then clinical features, you will be writing about history, that is bleed against a well-looking child. We'll be writing only about bleeding. Then diagnosis of exclusion. When to do bone marrow, I have included that also in a box because that is examiner's favorite question. Then treatment part, summary of the treatment I have written here, that is ITP, acute ITP, chronic, and the various divisions. Okay, and then secondary ITP, and then the prognosis. Here one thing which is to be added is new treatment modalities. Okay, I have not added in this, you can add it later on. So when an examiner sees a question paper as diverse as this, he'll be obviously forced to give you more marks compared to the other students who are behind you. Okay, so these are some of the tricks to write examination, to write for your theory exams. So I'll be coming up with few more topics, like short videos like this for 5 or 10 mark question, which will help you in your pediatric examination, whether it is undergraduate or postgraduate. So stay tuned, and thank you.